Now, tuberculosis, a scary word that brings up images of long hospital stays, quarantines, even death.
The upstate, no stranger to this illness. A few years ago, you might remember dozens of Greenwood County school children were infected.
And now a new investigation has started after an employee at a distribution center in Union County tested positive for the disease. 7 News reporter Brianna Smith talked to state health officials. She's joining us in the studio now. What have you found out, Brianna?
Hey, Tom. Today, several employees at the Belk Distribution Center in Jonesville were tested for TB after they were in close range with an employee who is now being treated for the disease. The Department of Health and Environmental Control descended on the Belk Distribution Center in Jonesville today, testing employees for a dangerous infection.
Historically, tuberculosis was responsible for significant morbidity and mortality.
On June 16th, an employee tested positive for TB. They were removed and started getting treatment immediately.
We initiate a contact investigation around each active case of tuberculosis that's reported in South Carolina.
An infection that spreads in the air through coughs and sneezes now puts an entire facility at risk. DHEC evaluates the air handling systems at every facility where there's an infection.
So what we look at is how open is the space where the individual who was infected was.
Which Belk says was relatively low risk due to their 98 HVAC systems on site working. DHEC now turns to those who were closest to the infected person for their investigation.
From the home to the work site to other places they frequent in the community, we investigate all of those contacts.
Investigations like this aren't rare in the upstate. In 2016, area counties saw 15 cases of TB last year, but DHEC hopes with awareness about the easy treatment of the infection that those numbers will continue to decrease.
We have done a really good job investigating people who have active tuberculosis infections. We follow up with individuals who are infected with TB but not necessarily ill, and we can treat them to prevent them from developing TB disease.
And obviously, you know, they tested those people today, but they haven't gotten those test results back. We will be following up with DHEC.
There's vaccines for a lot of things these days, Brianna. How about tuberculosis?
Well, there is one. In fact, I thought that there wasn't. And when I was talking to Dr. Bell today, she said, correction, there is a vaccine. It's only used overseas, though. It's not used here in the U.S. because we're seeing such a decrease of the cases, 130 on average across the state. So,
okay, we'll keep everyone posted on what happens with this investigation. Thank you, Brianna.